For the next item, we have our health and safety, our COVID-19 health and safety update for Henrico County Public Schools, and Dr. Teigen is coming forward with that item. Dr. Teigen.
Good afternoon, Madam Shea, members of the board, and Dr. Cashwell. I am here again this afternoon to provide the COVID-19 health and safety update. Well, we'll see. I don't either, but thank you. Today's agenda, and you have my presentation, right? Okay.
I think it just advanced.
She's taking care of it.
She got it, okay.
Yes.
Yep.
Today's agenda includes a review of the efforts to vaccinate and provide boosters to students and staff, an update on our COVID testing efforts, revisions to the volunteer guidance for school leaders, and modifications to outdoor recess guidance. So starting with vaccinations. The Virginia Department of Health continues to provide vaccinations at the remainder of our Title I elementary schools. And these schools, again, are listed on the slide. These are school-based clinics, and only students enrolled in those schools are permitted to participate in the vaccination clinics. And again, students, the vaccination requires written permission from the parent. They occur during the school day without the parent required to be present. And families should be receiving information directly from their principal. The first vaccination clinic at each of these schools will be completed by March 10th. And then the second clinics, the follow-ups for the second immunization, will be completed by March 31st. In addition to these elementary vaccination clinics, our VDH partners will be providing additional Saturday clinics at Fairfield and Elko Middle School so that students, their families, and staff may receive their COVID booster if they completed their primary series at least 6 months ago. Students ages 5 and up may also receive their first and/or second dose of the vaccine. In addition to the Pfizer vaccine for those students that are 5 years and older, they're also, for the individuals that are 18 and older, going to have the Moderna and Johnson & Johnson vaccines available at these clinics, as well as the Moderna boosters. And the first of the Saturday clinics will be held this Saturday at Fairfield Middle School. And the following Saturday, the Virginia Department of Health and their partner pharmacy will be at Elko Middle School. As a reminder, the Virginia Department of Health and Henrico County Public Schools staff have collaborated with Henrico Education Foundation, Henrico PALS, and the YMCA to provide targeted vaccination opportunities for our after-school program students and their families. These clinics are focused on students and families that participate in the after-school programs, but they are also open to the community at large. These are walk-in clinics where the individuals complete a consent form provided on-site at the event. All persons under the age of 18 must be accompanied by an authorizing parent or guardian to be able to receive a vaccination at these events. And parents are able to provide consent when they pick their child up at the after-school programs. And these clinics were specifically scheduled from 4 to 7 p.m., so it was convenient for the parent pickup. These clinics will also have the Moderna and Johnson & Johnson vaccines available for those who are 18 and older, and those Moderna boosters. 3 of the first round after-school clinics have already been completed, and those were Greenwood, Skipwith, and Penchback, and the other schools will be, they'll have their first clinic soon. They will also be following up with a second clinic to ensure that they are able to receive the complete series. Now, let's transition to testing. Test to Stay is an extra layer of prevention combined with vaccination and other mitigation strategies. And participation in the program allows students identified as close contacts through school or community exposure who are not fully vaccinated to continue in-person learning during their quarantine period if they test negative for COVID each day. Test to Stay requires those close contacts to take a test every morning or every evening for 5 days after exposure. If the test is negative, they are allowed to come to school. They must also, though, wear a mask and remain symptom-free for 10 days after exposure. Transitioning to screening testing, the latest VDOE and VDOH guidance for school divisions reiterates the importance of screening testing as a vital mitigation effort. Consistent with the newest guidance, we continue to participate in the VISTA program. The VISTA program provides take-home tests for students who present with COVID-like symptoms or have been identified as a close contact from a school or community exposure. Having these test kits is important to our families as they test to reduce quarantine times without requiring a doctor's visit. The screening of winter athletes is another program that falls under VISTA. While testing was not available at the start of fall sports, it was available to HCPS prior to the start of winter sports. The division opted to implement VISTA screening testing of winter athletes and their coaches. Weekly testing included all athletic programs at the middle and high schools. Part of the rationale for focusing on winter sports is that they were held indoors. As HCPS prepares to transition into spring sports, there's been much discussion at the health committee meetings as well as the leadership team about whether to continue screening testing for spring athletes. The CDC and VDH key factors to guide local decision-making were examined and considered. The low number of student outbreaks, the strong vaccination rate of individuals age 5 and older, and the wide availability of the Test to Stay program and the take-home test kits in schools, as well as the outdoor nature of spring sports, the Health Committee recommended screening testing not continue through the spring sports season. In addition to the key factors for local decision-making, it's important to note that the committee also discussed the feasibility of continuing with the program due to logistical factors, such as increased numbers of athletes and insufficient vendor and HCPS staff to meet the increased needs. This recommendation is supported by the leadership team. This information will be communicated to families of spring athletes this week as tryouts and tomorrow. And lastly, we have the take-home kits for staff. They continue to be available at every HCPS school or work site for staff members. These test kits are rapid tests and are available. They may get one each week, unless, of course, they're participating in Test to Stay for our staff, of which they can get additional tests. This is in addition to having access to priority appointments for PCR tests at the county's test locations. The final topics for today are related to volunteers in school and outdoor recess. At the last board meeting, the board requested the Health Committee revisit the volunteer guidance given recent milestones reached as a school division related to vaccination rates and test availability. The Health Committee did review the current 3-tier system and recommended moving to a 2-tier system, which is shown on this slide. Again, the revised guidance is a result of examining and considering the key factors to guide local decision-making, such as the number of student outbreaks, the vaccination rate of individuals age 5 years of age and older, and the availability of testing within the schools. Essentially, when the community transmission level is high or substantial, volunteers may now work inside or outside the school buildings. When inside the building, volunteers would not be permitted in classrooms, the cafeteria, or gym, but they would be able to be in office areas and copy room and other places like that. When the community transmission level falls below 50 new cases per 100,000 in that 7-day period, and the positivity rate is 5% is less than 5% in the past 7 days, then volunteers may work in classrooms, the cafeteria, and gym. The leadership team supported the rationale and the revised 2-tier system for volunteers, and this guidance will take effect on Monday, February 28th, 2022. And as a reminder, school principals approve and coordinate volunteer efforts in their individual buildings. This chart represents guidance for administrators when related to when and how volunteers may be used. In addition to discussion and rationale around volunteer guidelines, the Health Committee recommended and the leadership reviewed and approved revised guidelines for outdoor recess. While masks have always been optional for students when outdoors, the recommendation is to no longer require single cohorts in outdoor play areas, but consideration should be given to the size of the area and the total number of students to determine new larger cohorts. It is also important that schools are monitoring the participants in these larger cohorts in case there is a need to contact trace due to an outbreak. While the change in the volunteer and outdoor recess guidelines are shifting slightly, continued monitoring of outbreaks will be important to ensure the continued health and safety of our students and staff. And at this point, I'm happy to answer any questions.
Thank you, Dr. Tigan. I'll start with Ms. Offern.
Just one quick question. The testing that you mentioned, that staff can use the county site.
Yes.
How are we getting that information to them? How do they sign up? That kind of thing.
That's been communicated each time that the newsletter goes out, that the clipboard goes out to our staff, and it tells them the process is going through Oracle, and so they have that, and it has links in it, so it helps guide them through the process.
Yeah, I was just going to say, they actually, all staff received initially an email from me, and it included the information about Oracle, and then twice again in our clipboard newsletter. So that's been, I think, well communicated, and hopefully, if any employee would have a question, once they run into that scenario, I think school staff are well prepared to help walk them through it, whether it be the nurse or any other on the administrative team.
I just think that's such a great benefit for our teachers and staff to be able to have that access. That's all for me. Thank you. Thank you, Dr. Tigan,
You're welcome.
as always.
Thank you. Ms. Atkins?
No questions at this time.
Thank you.
Reverend Cooper?
Thank you, Chairwoman Shea. So first, Dr. Tigan, I just want to commend our staff for how they have continued to implement our mitigation strategies, and always happy to hear about low number of student outbreaks. So it definitely is indicative of the work that they're doing. Dr. Cashwell, you or Dr. Tigan, so since we've shifted to mask optional, can either of you share the temperature, how's it going, what's the feedback? I'd love to hear that, anecdotally, please.
I'm fine, I think obviously I'm a little bit more data driven sometimes on things, and we've been obviously monitoring outbreaks, and we've actually seen a decrease in time over the last few weeks, and that even includes the time without mask. And so that's one thing, and I think that from what I've heard and seen in schools is that it's sort of a new normal that individuals are understanding the choice. I think the questions rely more on staff and wanting to know where their choice is.
I would just mention that, when you, I think, ask about the temperature, we continue to emphasize the idea of tolerance and respect and respecting choices and individual differences. And so while that's always been something we've emphasized through our morning meetings and some of our other advisory blocks, it's part of our SEL curriculum, I think when there has been some tension, whether it's between students or staff and students, I think our administrators, our school counselors, our staff are prepared to have the conversations with our students related to respect and tolerance and helping to foster that and continue. So I'm not going to say there haven't been some difficult moments, but I think we have the right resources to lean on, and our staff are well equipped to help walk our families and students through any issues there. We want to be respectful of everyone's thoughts related to this matter.
No, I appreciate that, because I'm sure there's different feelings for staff members as well as for students, but as long as they know that we are 100% behind them as far as resource allocation and communication, I think that makes a big difference. So thank you both for that kind of update. Dr. Tigan, can you talk a little bit more in regards pertaining to our vaccination clinics, how they're going? Are the numbers going up, down, or are they flatline?
It varies from school to school, but we're still having good turnout at our elementary schools. Of course, this is the first Saturday in a long time that we'll have done them at the middle schools for those booster shots, as well as picking up people who may be wanting to get their first or second in the series, and so it's hard to tell because there's no registration. At least in our schools, we know how many parents are returning forms and how that's going, and that's still been going well at our Title I elementary schools. Only time will tell on the other clinics since they're walk-in, but I will tell you, we are seeing the percentage go up more significantly when you're looking at the 5 and older group. It seems like the percentage is jumping more each week in that range than when you're just looking at some of the upper age groups. So I feel like when you're looking at Henrico, you're seeing the impact of what the VDH and our schools are doing in our schools to help, provide that easy access for our families.
I appreciate you sharing in your presentation the symbiotic relationship between the VDH and Henrico and how the collaborative commitment that we both have has had an indelible mark as far as this is concerned. So thanks. And last for me is it's encouraging to see progress being made in our volunteer and outdoor recess guidelines. I think it says that we are definitely cognizant of the changes that we can make when we can make them. And I think it lets everyone know that we are trying to continuously move the meter on the new normal. So thank you so much, Madam Chair.
Thank you. Ms. Kinsella?
Yes, I appreciate Reverend Cooper asking the question about the transition. How is it going, across the division in our schools in response to the new law that was passed? So I appreciate you asking that, Reverend Cooper, and I appreciate the answer. Along that same line, in the new law that we're following with the option to mask or not on behalf of students, I know at the last meeting just recently, you mentioned employee interest in the optional mask. I know I've received some questions about what about the employees, and that's a Department of Labor rule that we're following currently. And then as I read current guidance, as other things are changing, do we expect this guidance to change as well and to at some point offer employees optional? And as a part of that, what about volunteers?
Yeah, we continue to, I think to your point, look at, as things are ever changing, the landscape related to the DOLE standards you're mentioning, they are under review right now. We expect that they would be repealed given the process that's underway. So we are watching that closely. We're also collaborating again with the health department, our county government counterparts related to practices that are in place, not only for county employees, but also for visitors coming into county properties. So we are continuing to look at that and of course, monitoring the change in landscape related to, again, increased vaccination rates, increased testing availability, and that community transition continuing to come down. So as we make any adjustments there, we would communicate that to our staff and families. But you're absolutely right, Mrs. Kinsella, those are the factors in play here that we continue to monitor and are seeing some shifting landscape there.
Okay. Thank you so much. That's all I have, Chair Shea.
Thank you, Ms. Kinsella. Thank you so much for going back and looking into the volunteer guidance. I know I've gotten a lot of questions about that. I think it's really important, as you noted, that the principal has kind of the final say in their building because they know what's truly helpful and manageable for their building. While 50 cases may seem a long way away, we're certainly headed the right direction with our community spread and the right direction quickly, right? We were at 900 cases, I think, 2 or 3 weeks ago, and then at 400, and now we're under 200. And so we're headed the right way quickly. So thank you again for revisiting those items. Anything else, colleagues? All right. Thank you, Dr. Tigan.
Thank you.
Sorry about that. My mic was off. Thank you, Dr. Tigan, and again, board members, for your excellent questions as we continue to monitor all things COVID-19 health and safety related.